NLN NEX Verbal Questions. Question 1. Which word is closest in meaning to evaluate in a classroom review sentence in this exam readiness item? Option A, ignore. Option B, judge. Option C, cover. Option D, deliver. The correct answer is option. Evaluate means judge, so that choice matches the meaning in context. Ignore means disregard, not judge. Cover means place over, not judge. And deliver means bring, not judge. Question 2. During a quick NEX review of a quick review item, which sentence uses a comma correctly? Option A. After the lecture ended, the students reviewed their notes. Option B. After the lecture ended, the students reviewed their notes. Option C. After the lecture ended, the students reviewed their notes. Option D. After the lecture ended, the students reviewed their notes. The correct answer is option. A comma should follow a longer introductory phrase. After the lecture ended, the students reviewed their notes separates the subject from the verb. After the lecture ended, the students reviewed their notes breaks the introductory phrase incorrectly. After the lecture ended, the students reviewed their notes places the comma inside the main clause incorrectly. Question 3. After checking the choices in a hard question item, which choice most accurately summarizes the passage? A hospital placed hand sanitizer near every doorway, and staff use rows during shift changes. Option A, doorways cause infections by themselves. Option B, safety improves only through written rules. Option C, making supplies easy to reach can support safer habits. Option D, staff should avoid sanitizer during shifts. The correct answer is option. The change made the desired behavior easier and more visible. Doorways cause infections by themselves is not supported by the passage. Safety improves only through written rules is not supported by the passage. And staff should avoid sanitizer during shifts is not supported by the passage. Question 4. If a easy question stem gives one clear clue, which word is closest in meaning to frequent in a classroom review sentence? Option A, often. Option B, rare. Option C, heavy. Option D, silent. The correct answer is option. Frequent means often, so that choice matches the meaning in context. Rare means not often, heavy means weighty, not often, and silent means without sound, not often. Question 5. When time is limited on a mock test question, which sentence uses the correct word? Option A. The new schedule will affect the review group. Option B. The new schedule will reflect the review group. Option C. The new schedule will affect the review group. Option D. The new schedule will infect the review group. The correct answer is option. Affect is usually the verb meaning to influence. The new schedule will affect the review group uses the noun or creation verb affect incorrectly here. The new schedule will reflect the review group means show or mirror, not influence. The new schedule will infect the review group changes the meaning to disease transmission. Question 6. Given the information in a diagnostic set item, which choice most accurately summarizes the passage? A nurse calmly repeated discharge instructions and asked the patient to explain them back. Option A, teach back checks whether the patient understands instructions. Option B, patients should memorize medical terms first. Option C, repeating words proves the nurse is confused. Option D, discharge instructions should be avoided. The correct answer is option. Having the patient explain instructions confirms understanding. Patients should memorize medical terms first is not supported by the passage. Repeating words proves the nurse is confused is not supported by the passage. And discharge instructions should be avoided is not supported by the passage. Question 7. Suppose a similar final review item appears on test day. Which word is closest in meaning to indicate in a classroom review sentence? Option A, repair. Option B, conceal. Option C, show. Option D, borrow. The correct answer is option. Indicate means show, so that choice matches the meaning in context. Repair means fix, not show. Conceal means hide, not show. And borrow means take temporarily, not show. Question 8. While working through a timed question bank set, which sentence is a complete sentence? Option A. The student reviewed anatomy before class. Option B, reviewing anatomy before class. Option C, anatomy before class the student. Option D, because the student reviewed anatomy. The correct answer is option. A complete sentence has a subject and a verb and expresses a full thought. Reviewing anatomy before class is a fragment. Anatomy before class. The student lacks a clear verb structure. Because the student reviewed anatomy is an incomplete dependent clause. Question 9. Before choosing an answer in a workbook page item, which choice most accurately summarizes the passage? A volunteer program grew after former patients shared personal stories at orientation. Option A. A former patients stopped the program. Option B. Personal stories can motivate people to participate. Option C. A volunteer programs grow without communication. Option D. Orientation should never include stories. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Former patients stopped the program is not supported by the passage. Volunteer programs grow without communication is not supported by the passage, and orientation should never include stories is not supported by the passage. Question 10. A student sees the study notes idea on a NEX review. Which word is closest in meaning to modify in a classroom review sentence? Option A. Change. Option B. Ignore. Option C. Repeat. Option D. Freeze. The correct answer is option. Modify means change, so that choice matches the meaning in context. Ignore means not notice, not change. Repeat means do again, not change. And freeze means make solid by cold, not change generally. Question 11. One revision guide practice problem tests this skill. Which sentence uses the correct comparison? Option A. This practice set is easier than yesterday's set. Option B. This practice set is easiest than yesterday's set. Option C. This practice set is more easier than yesterday's set. Option D. This practice set is easy than yesterday's set. The correct answer is option. Easier is the correct comparative form for two items. This practice set is easiest than yesterday's set uses a superlative for comparing two things. This practice set is more easier than yesterday's set uses a double comparison. This practice set is easy than yesterday's set omits the comparative form. Question 12. Several choices look tempting in a crash course item. Which choice most accurately summarizes the passage? A passage describes how sleep, nutrition, and review schedules all affect test readiness. Option A. Schedules do not matter. Option B. A test readiness is influenced by several habits. Option C. Only sleep affects learning. Option D. A nutrition prevents all test mistakes. The correct answer is option. The passage presents multiple factors that support readiness. Schedules do not matter is not supported by the passage, only sleep affects learning is not supported by the passage, and nutrition prevents all test mistakes is not supported by the passage. Question 13. For this online quiz nursing entrance question, which word is closest in meaning to obtain in a classroom review sentence? Option A. Melt. Option B. Deny. Option C. Get. Option D. Lose. The correct answer is option. Obtain means get, so that choice matches the meaning in context. Melt means turn liquid, not get. Deny means refuse, not get. And lose means no longer have, not get. Question 14. In a short answer key practice STEM, which sentence has the best word order? Option A. First questions the student hardest answered. Option B. The hardest answered student first questions. Option C. Answered first the student questions hardest. Option D. The student answered the hardest questions first. The correct answer is option. The correct sentence clearly states who did what and when. First questions the student hardest answered is not standard syntax. The hardest answered student first questions has scrambled word order. Answered first the student questions hardest does not clearly connect subject and verb. Question 15. Among the choices in a sample test item, which choice most accurately summarizes the passage? A nurse explains that antibiotics treat bacteria but not viral colds. Option A. Colds always require antibiotics. Option B. Antibiotics treat every infection. Option C. The key point is that treatments must match the cause of illness. Option D. Viruses and bacteria are identical. The correct answer is option. The explanation distinguishes bacterial and viral causes. Colds always require antibiotics is not supported by the passage, antibiotics treat every infection is not supported by the passage, and viruses and bacteria are identical is not supported by the passage. Question 16. Using the facts in a test bank question, which word is closest in meaning to predict in a classroom review sentence? Option A, borrow. Option B, forecast. Option C, remember. Option D, repair. The correct answer is option. Predict means forecast, so that choice matches the meaning in context. Borrow means take temporarily, not forecast. Remember means recall the past, not forecast. And repair means fix, not forecast. Question 17. Based on the clue in a skill practice item, which sentence uses a comma correctly? Option A. After the lecture ended, the students reviewed their notes. Option B. After the lecture ended, the students reviewed their notes. Option C. After the lecture ended, the students reviewed their notes. Option D. After the lecture ended, the students reviewed their notes. The correct answer is option. A comma should follow a longer introductory phrase. After the lecture ended, the students reviewed their notes breaks the introductory phrase incorrectly. After the lecture ended, the students reviewed their notes separates the subject from the verb. After the lecture ended, the students reviewed their notes places the comma inside the main clause incorrectly. Question 18. Consider this high-yield learning module concept. Which choice most accurately summarizes the passage? A patient skips breakfast before a long class and later has trouble concentrating. Option A, concentration is unrelated to food. Option B, classes prevent hunger. Option C, skipping breakfast always improves focus. Option D, nutrition may affect attention and learning. The correct answer is option. The passage connects lack of food with difficulty focusing. Concentration is unrelated to food, is not supported by the passage, classes prevent hunger is not supported by the passage, and skipping breakfast always improves focus is not supported by the passage. Question 19. Near the end of a structured test review session, which word is closest in meaning to prohibit in a classroom review sentence? Option A, compare. Option B, forbid. Option C, permit. Option D, repair. The correct answer is option. Prohibit means forbid, so that choice matches the meaning in context. Compare means examine likeness or difference, not forbid. Permit means allow, not forbid. And repair means fix, not forbid. Question 20. Across similar full practice nursing entrance questions, which sentence uses the correct word? Option A. The new schedule will affect the review group. Option B. The new schedule will infect the review group. Option C. The new schedule will reflect the review group. Option D. The new schedule will affect the review group. The correct answer is option. Affect is usually the verb meaning to influence. The new schedule will affect the review group uses the noun or creation verb affect incorrectly here. The new schedule will infect the review group changes the meaning to disease transmission. The new schedule will reflect the review group means show or mirror, not influence. Question 21. Since only one choice fits the nursing entrance clue, which choice most accurately summarizes the passage? A short article explains that dehydration can cause fatigue, headache, and dark urine. Option A. The article reviews bone injuries. Option B. The article teaches grammar rules. Option C. The article is mainly explaining signs of dehydration. Option D. The article compares hospital departments. The correct answer is option. All listed details point to symptoms of dehydration. The article reviews bone injuries is not supported by the passage. The article teaches grammar rules is not supported by the passage, and the article compares hospital departments is not supported by the passage. Question 22. From the information in a pre-nursing prep item, which word is closest in meaning to reluctant in a classroom review sentence? Option A, eager. Option B, silent. Option C, formal. Option D, hesitant. The correct answer is option. Reluctant means hesitant, so that choice matches the meaning in context. Eager means willing, not hesitant. Silent means quiet, not hesitant. And formal means official, not hesitant. Question 23. At a testing desk during a verbal practice review, which sentence is a complete sentence? Option A, anatomy before class the student. Option B. Reviewing anatomy before class. Option C. The student reviewed anatomy before class. Option D. Because the student reviewed anatomy. The correct answer is option. A complete sentence has a subject and a verb and expresses a full thought. Anatomy before class. The student lacks a clear verb structure. Reviewing anatomy before class is a fragment. Because the student reviewed anatomy is an incomplete dependent clause. Question 24. Inside a math practice, science, or skills item, which choice most accurately summarizes the passage? A clinic sends appointment reminders, and missed visits decline. Option A. Reminders caused more missed visits. Option B. Reminders can help patients remember appointments. Option C. Patients cannot benefit from reminders. Option D. Appointments no longer need scheduling. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders cause more missed visits is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and appointments no longer need scheduling is not supported by the passage. Question 25. Through careful reading of a science practice stem, which word is closest in meaning to retain in a classroom review sentence? Option A. Guess. Option B. Expand. Option C. Discard. Option D. Keep. The correct answer is option. Retain means keep, so that choice matches the meaning in context. Guess means estimate, not keep. Expand means increase, not keep. And discard means throw away, not keep.